Hey folks, Dr. Jeff Williams with Creekstone Integrated Care right here in Amarillo, Texas. Coming to you with another research-based blog to try to raise everybody's awareness as far as chiropractic. This week's research has to do with chronic low back pain and everything to do with that. So I really think you're going to like this one. Here's why they did it. With chronic back pain being so prevalent in our society, its significance, it really can't be overstated. The authors felt it necessary to attempt to better understand all aspects of low back pain, the treatment, and the outcomes. Here's how they did it. The authors examined the following areas to determine the use and effectiveness. So they examined imaging, opioid use, spinal injections, spinal surgery, and here's what they found: 629% increase in Medicare expenditures on epidural spinal injections. 629. 423% increase for opioids due to back pain. 307% increase in low back MRIs for beneficiaries of Medicare. There was a 220% increase in spinal fusion surgeries. All of this, yet there was no improvement in patient outcomes and or in their disability rates. Pretty outstanding. So let's wrap it up. Prescribing yet more imaging, prescribing more opioids or injections and operations is not likely to improve outcomes for patients with chronic back pain. We must rethink chronic back pain at the fundamental levels. Our understanding of chronic back pain mechanisms remains rudimentary, including our knowledge of spinal biology, central nervous system processing, genetic factors, and psychosocial and environmental influences. Greater investment is needed in this basic science research. Clinicians may often be applying an acute care model to a chronic condition. And there are no magic bullets for chronic back pain, and expecting a cure from a drug, an injection, or an operation is generally wishful thinking. We've been saying this for years, but a mechanical condition responds better to a mechanical solution rather than a chemical one. To me, it's common sense. So, just another reason to call a chiropractor today. Research and clinical experience show that in about 80 to 90% of headaches, neck and back pain, in comparison to the traditional medical model, patients get good or excellent results with chiropractic. Chiropractic care is safe, more cost-effective. It decreases your chances of having surgery, and it reduces your chances of becoming disabled. We do this conservatively and non-surgically. In addition, we can do it with minimal time requirements and minimal hassle on the part of you, the patient. And if the patient develops a preventative mindset going forward from initial recovery, we can likely keep it that way while raising the general overall level of health. Please feel free to leave us a comment. Tell me your thoughts. I'd love to hear what you think, and share. We cannot make a difference without your help. Be sure to find us on social media sites such as Facebook, Twitter, Google+, Pinterest, and Instagram. Also, be sure to subscribe to our YouTube channel at the link in the description. At the very least, just please take the time to give us a thumbs up right below this video. A gesture that simple really does allow us to get in front of more and more folks with some information we feel can help this profession and help our patients over time. Thanks so much for watching, and thank you so much for your help. Until next time, God bless.